Hello and welcome to StrandExplains, a podcast where we discuss what's happening in the world of precision medicine, from weird case studies and interesting facts to interviews with leaders in the industry. I'm Sakshi, and today I'm joined by Dr. Ramesh Kumar, who works in internal medicine and has been practicing since 1987. He was one of the doctors on the front line during the height of the COVID pandemic, and so we thought we'd ask him a few questions from a healthcare personnel's point of view. Hi, Dr. Ramesh. Thank you so much for joining us in today's podcast. How are you doing?
Oh, I'm fine. Great.
That's great to hear. So today's podcast, we're just going to be talking about COVID, like I mentioned, from a healthcare professional's point of view, to see what it was like from the front lines and see what the whole experience has been like. But before we get started, maybe could you tell us a little bit about yourself and your journey to becoming a doctor?
Yes, I've been practicing medicine for the last 35 years, and we have gone through the greatest pandemic which we have seen in the last 2 years, which has turned the tide against medical practice, and we had to learn a lot, relearn a lot about this new disease, the presentations, and who are the patients who are going to get worse. So that has been quite a challenging time in the last 2 years for all the medical professionals up front. Otherwise, the journey has been fantastic. I think it was all protocol based. I've had international experience, hospital based experience, presently on the office based experience side. So it has been quite challenging in the last 2 years for the healthcare professionals, especially.
Of course, understandable. So, like you said, it was a lot of relearning, and I'm sure a lot of learning as you go and on the ground training. But what was it like when it first hit? That March 2020 was when I think India really the cases started hitting. What was that experience like, and what was that period of time like for you as a doctor?
Yeah, the whole medical community was shaken up because we didn't know anything about this virus, its behavior, in the natural environment, its behavior in the patients. And gradually, once patients started coming into the hospitals, we realized that it could be, in majority of the cases, it is like a typical virus. 80% of them go through without any issues, especially the younger population. But we soon found out that people with comorbid conditions and the elderly people, vulnerable people, are the ones who are going to suffer from the illnesses and the complications at the most. So, by and large, 80 to 90% of the people are very mildly symptomatic. They don't require any major treatment. It's just close observation, hydration, good nutrition, and that's it. But the remaining 5 to 10% of the patients, especially the ones who are elderly or the very young, people who are on obesity, people who are taking medications for diabetes, hypertension, immunosuppressive drugs, these are the special watch populations. And they were the ones who were actually getting into the hospital. And moreover, even the kidney disease patients and dialysis patients. So we have learned a lot in the last 2 years in the pandemic on this COVID behavior, on the COVID complication.
Of course, I can imagine it just changing everything. I mean, I feel like it's also just changed the way medicine is practiced. If nothing else, telemedicine has become a much more prominent thing where earlier it was something that didn't exist. So I can definitely see the long term effects that it's had beyond just the way patients have been affected. Speaking about patients, people were justifiably scared, especially during the first and second waves. So, what was the panic like? As from a doctor's point of view, I know I personally called you once or twice saying, "Doctor, I think I have COVID. What do I do?" But I'm sure there were hundreds of cases like that. So, what was that panic like having to deal with it from a doctor's point of view? Because I'm sure it just that fear must have exacerbated the situation.
Yeah, so we didn't know anything about the first wave, but in the first wave, there were a lot of people falling sick and ending in the hospital. So in the first wave, we did learn a lot. I mean, it was all through trial and error method. People were panicking, including the medical fraternity. We didn't know how to treat, what were the medications, and we were seeing a lot of patients entering the hospital. The hospitals were getting overflooded. think the worst was the second wave. The second wave was even worse because more number of people were flooding into the hospital. In the first wave, it was the elderly people and people with severe uncontrolled diabetes and very obese people getting into the hospital. But in the second wave, it was the younger population that were getting in and falling sick. The unvaccinated, younger people with a lot of coronary, cardiac problems, kidney issues, diarrheas, and neurological problems. So we were learning a lot and facing a lot of problems in the second wave. The second wave was the worst wave. I think we had a lot of casualties, a lot of admissions, a lot of comorbid people entered the hospital, and even the younger population was affected in the second wave. So the first wave we were learning, second wave we were well prepared. I think now we are in a far better position. We know what is this virus, what treatment to give. Unnecessary antibiotics were taken off, unnecessary antivirals came in, they were taken off. So we were doing now evidence-based medicine practice after the second wave. But still, people were panicking. They were taking all sorts of medications, including traditional medications, over the counter medications, antibiotics were misused. So, we did learn a lot from the first wave experience that there are a lot of complications treating patients unnecessarily. It was just panic. People panicked. I think the medical fraternity also panicked. They could just, they were giving medications left, right, and center. I think what was a mistake we learned in the first wave, but that was corrected in the second wave.
Yeah, I can fully imagine just people trying to do whatever they can in those situations. And I guess it kind of does this experience does speak to the importance of evidence-based medicine. I know from a biotechnology point of view, there's been a real push in the last a few years to work not just with clinical based evidence but real world evidence and real world data. And I think COVID is just such a great example of the importance of something like that for sure. Um, and so, just as an aside, uh, because it feels like important to ask this question, do you think you saw a difference with people getting vaccinated? Could you see, like, as people getting vaccinated, were you seeing differences in number of cases and case presentations and things like that?
Yes, good question. I think after the second wave experience, I think a lot of people got vaccinated now, and those who were vaccinated in the after the first wave immediately actually had less uh, morbidity and mortality. They suffered less due to COVID, even in the first dose vaccine. And after fully dosed vaccine, these people were actually well protected. Although they did have infection. Getting an infection is different from getting a disease. You could still carry the virus, but you're not suffering from the virus. But when you get disease, that's the problem. You end up in a hospital or end up taking medications, you end up in complications. So, vaccinated people ended less in the hospital unless they had uncontrolled diabetes or they're carrying some other medical conditions which makes the virus behave very indifferent in them. So otherwise, by and large, 80-90% of the people who were vaccinated did not enter the hospital. That's one thing for sure. The death rates were actually maximum in the unvaccinated. More complications occurred in the unvaccinated. That we saw very clearly in the second wave.
That's really heartening to hear because I mean, obviously, it was a journey to get. One is just to get the vaccines going, experimentation, clinical trials, and then the rollout itself took a while. But it's very heartening to hear that you can see from a medical point of view a stark difference between those unvaccinated single dose, second dose, and now with boosters being rolled out in India, hopefully we can carry that on and keep ourselves as protected as possible. um, One thing that people have been talking about recently, especially as most of the population gets vaccinated as they start getting their boosters, is the idea of COVID becoming endemic, it becoming another cold or another flu that you get your booster once a year and you carry on with life. And rather than the statement being, "Oh my gosh, I've got COVID. What do I do?" It becomes, "Oh yeah, I had COVID a few weeks ago." So, what do you think about COVID becoming endemic? Do you think it's something that just is going to stay with us, or do you think eventually it will, it will die out? So,
Yes, the virus is going to stay forever. That's very clear. You can get mutants. They keep appearing once in a while. That can cause certain small waves. It's going to become endemic. It's not going to get. We don't. I don't see forecast another pandemic. No, it's going to be an endemic. The vaccine is going to be probably an yearly affair. The boosters are going to keep coming on. It's just like the influenza virus. The influenza virus, which we know for the last 30, 40 years, we know we have to take the vaccine every year. The same thing is going to happen to COVID. So the COVID coronavirus, we are going to take the vaccine probably for the mutants, the variants, probably every year is going to be annual affair, and we are going to see less of the pandemic. We're probably going to be in an endemic. We are entering all endemic phase. Maybe a small waves here and there in the world we are going to see.
that's honestly that's great to hear. Speaking of small waves, there is speculation that there's a fourth wave coming sometime in June, July. However, in addition to that, COVID fatigue seems to have really set in, and public consensus is, like you said, COVID can be treated as a flu. However, um, the CDC and the WHO have still been coming out with, and the ICMR for that matter, have still been coming up with notices about how important it is to still treat COVID with some caution, to still keep masking behaviors. Uh, what are your thoughts on this? Is, as this next wave might come about, at the same time as COVID fatigue, do you think it is something we can just move on with our lives, or what are your thoughts on this?
Yeah, I think it's all about lives and livelihood, isn't it? So first is always life. If life has to be saved, I think people still have to be cautious. We still have to go with the masks and all the protective gear in a high risk environment very clearly, because that's going to go on for the next few months, maybe a year or so, till the COVID becomes almost endemic and loses its aggressive behavior. Vaccine is the way forward. I think all the population, if they are vaccinated, I think we can deal with the virus even more effectively. Having said that, today we see even flu causing pneumonia and then ending in hospital. So we got to watch out. Even the coronavirus can cause bad pneumonia and complications. So in the high risk population, so you've got to be watchful. Don't take the virus lightly. Yes, it's going to be in majority of the people, 80-90% like a common flu, like a common cold. So it is going to be less virulent, but we got to watch out for this virus in the high risk population. It can behave in a very different way. So vigilant vigilancy is important. Can't take it lightly. Everybody should be vaccinated and still follow COVID appropriate behavior. That is important.
I got it. Thank you so much. Yeah, I wholeheartedly agree with what you said, and hopefully, like you mentioned, this will become endemic and will just become something that you get an annual booster for. And I can't wait for that point. So those are all the questions I had. Thank you so much, Dr. Ramesh, for taking the time out to talk to me. Were there any final thoughts or anything else you would like to say before we cut off?
Yes,
Finish up?
I think we should still follow the COVID appropriate behavior. That's important. I would encourage all people to vaccinate themselves because we are probably expecting the third wave coming up somewhere in the next 1 or 2 months. So I would exercise utmost caution. At the same time, watchful. Be watchful. Be aware where you are going. Public overcrowded places. Be careful. Mask yourself. Sanitize yourself. If you are going to a hospital, please wear mask. Do not take this very lightly. Not only from the point of COVID, you are even preventing the other infections that people can transmit through the respiratory route. So I would say caution. You be careful. COVID appropriate behavior. Vaccinate all the vulnerable people. Must.
That's great advice. Thank you so much, doctor, and thank you again for taking the time out to talk to me. This has been a great conversation,